We got recording going. So before I get into it, I wanted to introduce you guys to some of the ACOEP-RSO board. So whoever's on from the board, will you hop on, introduce yourself, tell us where you are, either a resident or in school.
I'm Coral. I am a resident at EVMS in Virginia. I'm the president of the organization. I've been on the board for like ever now. So if you guys ever need anything, I'm here to help and answer any questions. And if I can answer anything during this, I'll keep an eye on the chat or I can answer vocally as well. So Alex is a queen though, so she's gonna do great.
My name is Sarah. I'm an OMIS 3 at Lincoln Memorial College of Osteopathic Medicine. I'm one of the conference chairs this year on the board. So I'm helping out with planning our spring conference and also our fall conference next year. And it's going to be super, super awesome. And we have a bunch of networking and mentorship opportunities and some really cool lectures. So everyone should come and it's going to be great. But yeah, that's what I do on the board.
Hi everyone, my name's Amber. I'm a third year at Western University and I'm the GME chair. And yes, everyone please come to our conferences each year. We're working really hard on them and they're going to be awesome.
Sweet. All righty. Is there anybody else on? I don't think so. But this is the rest of the board. We've got a couple residents who are involved and they all love mentorship as most of us do in the board. So please feel free to reach out to any of us at any time. A shameless plug again, we are kicking off the mentorship series. So this is kind of what we have lined up for the next couple months, but there's a QR code at the bottom that you guys can scan. It'll take you to a Google form to fill out anything that you guys might want to hear about. We can do more than one per month. And I will also pop this up at the very end. That way you can scan it again. And Sarah already mentioned this, shameless plug, come see us at Spring Seminar. Our resident and student programming is on April 27th and 28th. So let's get into it. My plan, like I said, is we're going to talk about VSLO, applying, how to navigate VSLO. It's a little bit complicated and what you should look for in a program. And all of this is kind of my personal experience, having talked to the mentors that I've been fortunate enough to have over the past few years, whether it's through ACOEP, through going to conferences and all that kind of stuff. So kind of my own opinion, but with a lot of guidance in the meantime. So what is VSLO? You probably heard this term. It is the Visiting Student Learning Opportunities. This is what the website looks like, and we're kind of going to navigate through piece by piece into each section of the website. That way you can figure out how to navigate it. So this is where you apply for your acting internships, your sub-internships, your audition rotation, whatever you want to call it. We all call it different things, but it all means the same thing. And then just a little disclaimer, not all programs use VSLO. So some programs you can either apply to on their own individual websites, or some of them use Clinician Nexus, but a bulk majority use VSLO. So I only applied to programs through VSLO. So that was kind of my experience going through this last year. So that's what I will talk about most. So you're in VSLO. This is something that you can start to do immediately. VSLO officially opens, I think in February, but the date might be changed from last year. But this is some stuff that you can go ahead and put in. So this is kind of what the first page looks like. Important things to note: your contact details. Your phone number is what's going to be used during your interview season. So if something goes wrong on Zoom or on any of the platforms that programs use for their interview season, if something goes wrong, they're going to pick up the phone immediately and call your cell phone number. So make sure it's a good number. Your email address that you use. Email, you make it something that you check. You're going to get a lot of emails during this time from VSLO, and then when you go into ERAS to apply for residency. So make sure it's a good email address for you. Some people like to go ahead and make a brand new email address. I personally didn't make a new email address until I started applying to residency. I used my ACOM, my school email for VSLO. Personal preference, totally up to you. It doesn't really make a difference. For ERAS, for residency, it does, because some interviews are kind of first come, first serve, even though there's supposed to be enough spots for everybody. If you get an interview invite, there should be a spot for you, but maybe you want a particular date of time. So I had my phone near me 24/7 through this entire interview season. That way I can make sure if I got an email for a program, I was on it within like 30 seconds to sign up for a time. So if you want to go ahead and make that email address, go for it. the address that you list. So you're able to put a permanent residence and a like current residence. So I put my permanent residence back at home in North Carolina, where I'm from, and then my residence in Mobile, Alabama. Programs are going to send you swag during residency interview season. So make sure you put in an address where you will get your swag. Some programs still send it to your permanent address. So like my mom sent me photos of cute packages that I got from different residency programs. So that might happen. Just make sure your address is your expected, stuff might come. And then at the bottom of your personal information page, there is a section that says the short bio. And every year there's discussion, do I fill it out or do I not fill it out? One of the people I really look up to, who's a resident on the board right now, they filled out their short bio with the most creative thing ever. I am not that creative. I personally ended up just not filling out the bio. I didn't really feel like I had anything that was like crucial to say, but I'm also not super clever. So I didn't do it. I don't think it hurt me at all. I got auditions at the places I wanted to audition. But if you're super creative and witty and can come up with something fun that makes you stand out in another way, go for it. I don't think it's going to hurt you one way or the other to do it or not to do it. So moving forward, then you have to go to your academic information. This is pretty simple. You just put in the dates that you've completed your core rotations. A lot of the rotations require you to be completely done with your course. So if you're joining us and you're a third-year med student, hopefully you've done most of your course by this point. My school doesn't require neurology, so that's why I don't have it filled out, and it didn't hurt me. But some programs will require you to have certain rotations done already, like your surgery rotation. That way they know that your suture skills are up to what they need to be coming in as a rotating student. So just be wary. Younger students, first and second years, as you think about how you want to lay out your third year, knock out your course early. That's what I advise anyone that I mentor. Some people are like, I want to start doing electives immediately. And I get it. We want to figure out what we want to do. We want to start jumping into the things that we're interested in, but the cores are cores for a reason. And I think it's wise to just go ahead and knock them out. Again, personal opinion there. So this is where everything is going to get a little bit complicated. You've now clicked on the Find Elective tab at the top of the web page. This huge filter thing pops up. You can use any of these filters how you like, but the most important one is we're going emergency medicine. So let's click on emergency medicine to filter, right? There's different, obviously, subcategories that you can do for emergency medicine. The one that's in blue highlighted is your main emergency medicine one. If you're interested in EMIM or PEM or EMS, go for it. But the main filter that you want to go for is specialty emergency medicine. When you're trying to figure out which rotation to click, because when that pops up, there are hundreds of options. There are so many options and it's overwhelming, but it's going to be okay. The acting internship or the sub-internship, like I talked about before in the ambiguous titles, that is going to be your sub-I. That's what you're looking for your main audition rotation. Court guidelines have always recommended 2 rotations in the past few years, 3 in some like extenuating circumstances. I couples match, so I did do 3, but the recommendation is 2. But that being said, there are other ways around this. If you really want to go see a program and you've already picked your 2 sub-Is, you can do different types of rotations. So you can go through and filter for anything like toxicology, ultrasound, EMS, resus, simulation. The list goes on and on. All of these are a great way to get your foot in the door at any program if they have these types of rotations. So me personally, ACOM, we don't get a lot of ultrasound experience on our rotations. I really wanted to get more confident in ultrasound and just be able to go travel the country a little bit more. So I also did a 2-week ultrasound rotation and I don't regret it. It was fantastic. I am so much more confident in my ultrasound skills because of it. I am doing critical care right now and my attending keeps saying, Alex, go grab the probe and go scan so-and-so for me, see what's going on. It's really, really useful. So I highly recommend whether you are just interested in a certain subspecialty of emergency medicine or you want to go see another program, this is a great way to do it. And then you're also leaving sub-Is up to other students up for grabs. So the essay and other required documents. Every single program is going to have a different list. This is the list from one of my sub-Is, and it looks like a lot, and it is. A good amount of it is going to come from your home school like whether it's the drug test, the transcript, the letter of recommendation. As you can see, those are all listed as homeschool items. But a lot of it is up to us to upload. A lot of these documents you can go ahead and start doing now. You can go ahead and start uploading documents into VSLO. That way they are ready to assign once you start pulling up the sub-Is that you want to do. Things to remember though, your drug test. My school's drug test, I did it way back when at the beginning of third year. So it wasn't going to cover me for my sub-Is for fourth year. So I had to go pay out of pocket for another one. I know some students had to go pay for titers. Some people had to go redo their TB and pay for it. So these are costs that you might not think of that you want to be aware of. And then I think the biggest stressor on this is the letter of intent. Every rotation that I applied to had some form of letter of intent, letter of interest, you name it. But pretty much they all were foundationally, why emergency medicine and why do you want to rotate at our program? Why are you interested in talking to us? Why do you want to come see us? So that is something you can go ahead and start working on if you haven't already. Start piecing together kind of a little mini personal statement. This isn't your ERAS personal statement. This is just a letter of interest. Why do you want to rotate here? I talked about why I love emergency medicine and why I think I'll be a great candidate. And that's what I sent. Each program, some of them will ask for different things, like if it's in a different city you've never been to before, maybe you should talk about like familial ties to the place. Maybe your aunt lives there, whoever. Or maybe you've been there before and you really like the city. Or maybe you just want to go on an adventure and explore the world. You're single and you're ready to go somewhere else for residency. That's a fine reason too. So just be honest in it. That's one of the biggest things you'll hear throughout all of this is be honest and be yourself, and it'll show. So big frequently asked questions. That is the bulk of the VSLO website. That's the worst part. But some questions that we'll go through. How many programs should I apply to? Everyone you're going to ask is going to have a different answer. In my opinion, don't apply to more than 10. Seriously, that might not sound like a lot. Save your money. It's $15 per application. I applied to way too many programs. I started getting accepted to all of them, and I started panicking. Don't do it. Do 10. You'll be safe. I promise. It'll be okay. I think 10 is a good number, maybe 15 if you're worried about maybe something that is going to come across in your application on your transcript, your step, or your COMLEX, whatever it is. But I don't think you need to apply to as many as you think you do, really. Save your money. Save it for a trip in fourth year. When do I need to apply? The day the rotation opens. Most of these are first come, first serve with some filtering. Programs are, of course, going to look at your application, why you're interested. Are you a good fit for their program? But it really comes down to who applies first. So I made an Excel spreadsheet of when is the date that's listed on VSLO, when is the program that I'm interested going to open, and the day that it opened, the day it popped up, I submitted it, and it worked in my favor. Like I said, I got way too many rotation offers, and it was scary, but it was okay. Now, the caveat to this is a lot of them don't follow what's listed on VSLO, and it was kind of frustrating. So the program might have when it's listed, but they can really open it to applications whenever they want. And that definitely adds a layer of stress that I was personally not a fan of for obvious reasons. So I pretty much checked it every morning and every evening to see if my programs that I was interested in opened, because you can save them and you'll see when they open, you'll get an email, but not always. Sometimes you get an email that they open, sometimes you don't. Not trying to stress you out. I'm just trying to keep it real and tell you how it was. So be on top of it, check regularly for the programs that you're very strongly interested in, and make sure you apply immediately. Can I drop an elective or will I get blacklisted from a program? So say you applied early in February, and I guess I didn't mention programs can open again whenever they want. So some that I applied to opened pretty early, like February, March. And then there were some programs I thought I was going to rotate at that didn't open until May. So how do you navigate that, right? Like you're accepting them, you know you have to have 2 slows, so you need to accept 2 rotations, but the program you're interested in is in May. Just go ahead and accept the ones that you think you're going to take. And then if you get a program that you truly think is going to be your number 1, or there's somewhere that you're really more excited about, drop it. It's okay. Drop it within a respectful amount of time. I would say about 2 months out, because they need to fill that spot. Email the program coordinator. The coordinators are the rulers of the residency program. The program director is fantastic. They've got other things to worry about. The coordinator runs the program, runs the show. So apologize for the inconvenience. Say you're backing out, say you want to give the opportunity to another well-qualified student, and it'll be okay. I still got interviews at programs that I dropped, even kind of late, which I hated to do. And then finally, what if I get accepted to conflicting dates? Same thing, email the coordinator, ask to change. They're so understanding. I ended up having to rearrange my 3 sub-I dates entirely because the first one that I got, I set the date, it was great. Got my next one, Chapel Hill, they were off cycle, so I had to move them up because of the way my school works and having to take the time off for having them off cycle. So email them, work around, it'll be okay. They're super accommodating and understanding. So there are 278 emergency medicine resident programs. How the heck do you even decide where you want to go? There's a lot of things to consider. There's a lot of things to think about. And these are things you need to start piecing together when you pick where you want to go rotate. So these are things that I looked for in a program, is things that I've talked about on the interview trail, things that are important to me. This isn't, an all-encompassing list of things. This is just things that I thought were important and things that maybe you haven't thought of, and just ways to differently look at the program lists. So first things first, a 3-year versus 4-year program. There are 3-year programs out there. There are 4-year programs out there. I personally, for residency, did not apply to a single 4-year program. That is because I'm interested in doing a fellowship. So it just really didn't make sense for me to go to a 4-year program when I could do a 3-year program plus a fellowship. To each their own. But that is a pretty easy filter to start looking at. Academic versus community versus county programs. This is something that you can look at on different websites. You can kind of get a feel looking at some of the big program lists of MedMap is a great website. The EMRA Match website is fantastic for help. But academic versus community versus county. So what is the difference? What does this mean? Academic institutions are your, bread and butter, big name, quote unquote, emergency medicine programs at large universities that have multiple residency programs. They are all 3 of these are fantastic. Let me just go ahead and say that. I chose to rotate a different program so I could try to get a feel for each. Each one is going to have pros and cons, and you kind of have to figure that out for yourself. Kind of the large way people like to talk about this is that an academic program, you're going to have a lot more consultants, you're going to have a lot more resources and all that kind of stuff. So maybe you don't get to do as much per se in the ER because it's very easy to say, well, I'm really busy. I don't need to do the reduction because we have orthopedic residents who can come down and do it. Versus maybe at a community program or a county program, you're doing everything down in the ER. So it really is just a matter of what is your feel. A lot of programs rotate at both true academic sites and community sites. And then your county programs, again, it's just kind of the population that they serve. There aren't really as many county programs in the country, but they are usually really high volume, high acuity, kind of run the show down in the ER. Like I said, you really can't go wrong with either one. I loved my rotations at all 3. My first sub-I, I got to rotate academic and community sites. And then my second sub-I was a county site. And I loved bits and pieces of both. So something that was really important to me was, do they rotate at multiple hospitals? Do I get a feel for all of them? Am I at the academic institution and I go to the community shop and I'm the only one in the ER covering everything? That is what I was looking for in a program. So places that rotate at multiple, because I really truly did love bits and pieces of the academic, the community, and the county vibe. What fellowships do they have? I mentioned that I'm interested in a 3-year program because I like a fellowship. It definitely makes it easier if they have the fellowship at the program, right? Because you start to get your foot in the door. You can get some mentors and all that kind of stuff. So looking what fellowships do they have? Are there things that you're going to be interested in? And with fellowship offerings, you can also do tracks. A lot of programs will have different tracks that you could do. that just give you a little bit deeper insight into what the like niche of medicine looks like. How much time do they spend off service? Looking at what their curriculum is. As an intern, that is the year that you spend the most time off service. And most programs, it's entirely in different types of critical care units, whether it's the SICU, the PICU, the MICU, whatever ICU you could come up with. That's typically where you are as a intern. But some programs also like to do medicine wards. If you like rounding, maybe you want to find a program that has some medicine during intern year. Not for me. I don't like rounding. So I looked at that. And then there were also some programs that I looked at that highly advocated for the fact that they did a lot more off-service rotations during intern year than you would expect compared to some other programs. So I thought that was interesting because I'm like, I'm going to be an intern. I finally get to do emergency medicine, which I love. Like, I want to be in the ER all of the time. Number of shifts per month and the shift length. I don't like 12 hours. I'm going to say it. I'm not a 12-hour shift girl. That is something that I looked heavily at, and it's something I weighed heavily. I prefer my 8 to 10-hour shifts because I like to do things during the rest of my day, and I'm okay working more shifts per month. That's usually the caveat. A lot of programs will be 19, 20, 21 shifts. They do like between 8 and 10, and then they have like a little bit less, maybe 16, 17, 18 per month if they're 12-hour shifts. So to each their own, that's totally up to you. But a question to look at on the number of shifts per month is, are they on a full month block, like 31 day, 30-day calendar month, or do they do 4-week, 28-day blocks? Because 21 out of 28 versus 21 out of 31, it's 3 extra days off, right? So figure that out, do the calculations of how many hours per week do they work. Longitudinal pediatrics. This is something that I was really passionate about looking at programs and their curriculum. Little ones are scary. Little ones in the ER are even scarier. So going to a program that gives you good exposure of pediatrics over the course of your 3 or 4 years is also something that's important. Kids get different kind of illnesses during different parts of the year, right? Like summertime, you get more trauma because they're outside bouncing on the trampoline and they flip backwards and they break their arm, versus RSV time, you know? So being able to see peds throughout the entirety of your career, whether that's they do a couple shifts per block or they have like 2 weeks at a time, that was something that I wanted to do, just because I don't know where I'm going to end up one day, whether I end up at an academic institution or at a community site. You know, your more rural sites, you see everything that walks in the door. Your academic sites, you might have a pediatric emergency department. So since I don't know where I want to be prepared for everything. So longitudinal peds was something I looked at. How are traumas run? This was something that as a 3rd or 4th year, I was like, traumas are awesome, right? Like we like emergency medicine. We unfortunately like the gore. So how are traumas run? Now that I've gone through all of this, I've learned traumas aren't as important because they're algorithmic. Of course, like you'd like to know whether you are always involved in the trauma or do they have a separate trauma unit, but I promise this isn't as important as you think it is. But I know it's something that I'm not really going to persuade you on. You have to go through it for yourself. So figuring out how traumas are run is something that's important. Are you always airway unless you're on trauma? Do you get to run the trauma? Are you Monday, Wednesday, Friday doing procedures, and then Tuesday, Thursday running like the bed and running the room? So every program kind of has a different format of how they like to do this. You just have to figure out what do you think is going to be best for you. Pay and cost of living. Every program gets paid differently, and every city is a different cost. So if you're getting a low salary in a high cost city, your way of life might not be as great as if you're in rural medicine getting paid nice, right? The money goes a long way, and we don't get a lot of it as residents. It's something to be aware of. So just looking at your cost of living versus pay and figuring out how that's going to best accommodate your lifestyle. Moonlighting opportunities. During 2nd or 3rd year at a lot of programs, you're allowed to start moonlighting. That means you get to make extra money to offset the low pay and the cost of living that we just talked about. Some programs only allow you to moonlight as a 3rd year. Some allow you to do 2nd year. And then some programs have internal and external moonlighting opportunities, or some only have one or the other. Internal moonlighting opportunities means you get to rotate at your program and you have the backup of the attendings around you. You're usually in like fast track area doing the lower acuity things, or you're rotating in one of the ICUs for off hours, but you have the backup. External moonlighting means you are out in the community somewhere, typically by yourself. Of course, you are always a phone call away from your attendings and your co-residents, but it's a little bit scarier. That is something that I've heard, though, that programs in the job market like to look for. Have you moonlighted? Because it shows you have maybe a little bit more confidence, a little bit more edge compared to peers who maybe didn't moonlight as much. And you're just starting to get your foot in the door, figuring out how you're going to be as a physician and developing your practice style. So I think it's really important to have moonlighting opportunities. It's something that I'm really looking forward to do. And then whatever else is important to you, right? If you don't like being outdoorsy, if you don't want to go skiing and mountain climbing, biking, all of the things, maybe don't go to Utah. Maybe don't go to New York City if you don't want to live in a big city, right? Don't go into rural nowhere if you want to be at pro sports all the time. And then don't move to California if your family's in North Carolina and you want to see them every weekend, right? Little things that are important to you that are going to make your lifestyle the best that it could possibly be when you're not at the hospital is really important. You have to fill your cup up before you can fill up other people's cups and be a good advocate for your patients. So do what's best for you first. So why does it matter where I rotate? Well, this is the first time maybe that you're going to be in the emergency room. This is when you get to learn. This is the most exciting part of fourth year. It was my favorite part of fourth year. It gave me like the itch to get back in the emergency room that I have not been able to fill until this critical care month. It's been fantastic. But it's really the first time that you get to be there and truly be autonomous. I mean, on these sub-Is, you're expected to act like an intern. That's how you show that you're good, and that's how they want you, is that you can come in there and you can go see the patient and you can make a differential and you can go in there and suture them. Like the things that you are expected to be able to do kind of as an intern early on is what you're going to do when you're out there. And it's such a cool feeling and scary feeling to start having that autonomy and making decisions, but it's okay to be wrong. Like they know you're a med student. This is where you're starting to learn for the rest of your career. So you're learning and developing the skills necessary to be a quality emergency resident. But also, let's be real, it's to get a SLO. You are here to get a standardized letter of evaluation. And if you don't know what that is, it is pretty much the most important component of your residency application. When you go do your sub-I, your audition, your acting internship, at the end of the rotation, you're gonna get a SLO. And everyone is evaluated in the same format and they can put comments in there, but this is considered the most important part of your application from program directors when applying to residency. So you are going to get a baller SLO. You are going to go rock your rotations, but it is important. It is intimidating. It's nerve-wracking. I mean, you are in there for a lot of hours in the ER. You have to put your best face forward every single day. It's scary to be wrong because you're like, oh my gosh, I just said something so stupid. I didn't know the answer to the most basic question that I should have known. They're not going to take me now. No. Like, it's going to be okay. I understand it's stressful, but you're there to learn. You're there to get your SLO. It's all going to be okay. That is just about everything I have. I covered a ton of information and I went kind of fast because I wanted to be somewhat respectful of everyone's time and be able to open it up to questions, comments, concerns, and any compliments that you might have. And then I'm going to go ahead in the meantime and pop this back up there. That way you guys can see what we have coming. And that way you can scan the QR code and let us know what you want to hear about. If anyone has any questions, the floor is open.